Good evening and welcome, everyone. I'm calling the 438th Council meeting to order. Welcome to this special meeting of Council, and thank you for making yourselves available on short notice. A reminder, Council members, to please have your video on during the meeting, but mute yourself if you are not speaking. We are live streaming this meeting through the RCDSO's YouTube channel so that members of the public, profession, and other stakeholders can observe our proceedings today. And again, just a quick reminder to please use your Zoom hands for voting, as well as for questions and comments. I would like to turn to the official opening of our meeting with a new land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis people from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and to this land we live on and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role in regulating dentists, in protecting the public interest, and in strengthening our partnerships with the Indigenous communities in order to advance access to safe and equitable oral health care. Thank you. And I'm going to turn it over to the Registrar and CEO, Dan Faulkner, to do the Council roll call.
Thank you, Hanno. I will go through Council in alphabetical order, so just be prepared to unmute yourself and let us know that you're here. Nalan Bhargava.
Present.
David Bishop.
Present.
Amelia Chan.
Present.
Ram Chopra.
Present.
James Colliver.
Present.
Christina Cordero.
Present.
Peter Delane.
I am present.
Nancy DeSanto.
Present.
Mark Eckler has sent regrets. Ellie Fisher.
Present.
Noha Goma has sent regrets. Daniel Haas.
Present.
Vivian Hu.
Present.
Nizar Ladak.
Present.
Anthony Licio.
Present.
Anthony Mayer.
Present.
Harinder Sandhu.
Present.
Brian Smith.
Present.
Usama Solomon. Okay, we'll watch for him joining. Robin Somerville has sent regrets. Rod Stapleforth.
Present.
Mark Trudell.
Present.
Aaron Walker.
Present.
Judy Welakovich has sent regrets, and Deborah Wilson.
Present.
Thank you very much. Hanno, back to you.
Thanks, Dan. And now I'm going to turn it over to Dr. Harinder Sandhu to provide a few opening remarks. Harinder?
Thank you, Hanno, and good evening, everyone. I so appreciate your willingness and ability to meet on short notice. Before we begin, I would like to introduce to our newest Public Council member, Nizar Ladak. Nizar has been a CEO of digital research organizations, a leader in healthcare, and a long-standing board member in the education, social services, and healthcare sectors. Nizar will be serving as a member of the Inquiries, Complaints, and Reports Committee. Welcome, Nizar. Please welcome him.
Thank you sincerely. It's a pleasure to be here.
Thank you. Thank you, Council. And so tonight we'll be discussing a critical matter related to emergency clause of regulation. As our meeting in June, Council approved the establishment of a small working group to help direct implementation of the regulation amendment. The group, which includes Usama Solomon, Nancy DeSanto, Ellie Fisher, Brian Smith, and me. We have met to discuss a number of issues needed to establish the required infrastructure to implement the regulation and support the decision tabled by the regulation amendment in the event of an emergency. However, late last week, RCDSO staff received a proposed and significant change to the regulation amendment that Council discussed and approved in April. Staff will lead the discussion with you, but I would like to take a moment to acknowledge all the work that has gone into preparing us for today. Andrea and her team have been tireless over the past few days. Thank you, Andrea, and your team. I would also like to acknowledge the member of the public who are joining us through YouTube channel. We appreciate your interest, so thank you for being here. With that, Hannah, I'll turn it back to you.
Thank you, Harinder. Our next item on the agenda is a declaration of conflict of interest. Do any members of council have a conflict of interest to declare for the agenda item being discussed today? And I'll pause for a moment. I see none. Thank you very much. What I would like to do now is turn it over to our Registrar and CEO for some introductory remarks. Dan.
Thanks, Hanno. And I don't have a usual report because it is a special meeting with a very specific topic. So I'll keep my remarks quite brief, but I want to reassure council that this part of the regulation making process is actually normal. And so it's been some time, I think, since this college has developed and sought approval by the Ministry of Health for a regulation. And in fact, probably some of our new members have never been involved in the regulation making process before at all. So it might feel a little bit daunting that we've called this special council meeting with 3 days notice, but there's a couple of reasons for that. And I just want to briefly mention them, and you'll hear more from Andrea in a few moments. But first, council is the body or the entity of the college that needs to make these decisions, that any aspect of your proposed regulation that might be a substantive change, you need to look at that and approve it. And Andrea is going to take you through the language shortly that we've deemed to be substantively different. Now, we don't necessarily see it as a problem or a concern, but we'll walk you through that in a moment. And secondly, the Ministry of Health is required with this regulation to meet very tight deadlines. There's an overarching legislation that prompted these regulations to be developed by all 26 health colleges. And the legislation itself says that the regulations have to be approved by August 31st. So these are deadlines that are imposed externally. All of this was discussed with you in April. And notwithstanding, there have been discussions since we submitted the proposal on May the 1st. The ministry staff and the RCDSO staff have been talking about this regulation. But as Harinder, our president, said a few moments ago, we have some late-breaking language that we're asking you to consider, and we have to balance that with the deadlines that are required through legislation. So my final comment to you before I turn it back over to Hanno is just to assure you that several staff in the college have literally been moving mountains to get this work done. This is an extremely tight timeline where we learned in January that we had to develop these regulations, and you don't often develop regulations in 7 or 8 months. So we have been doing everything that we can to support the ministry's goals and this effort and achieving this direction. And we're going to continue to do everything tonight and in the coming days to make sure that we bring this to conclusion as well. So I wanted to provide that assurance to you and a little bit more context. And Hanno, I'm going to turn it back over to you so we can get to the topic at hand.
Thank you very much, Dan. Council, our one item this evening is a strategic matter for the college on the subject of the emergency class of registration. Under the Pandemic and Emergency Preparedness Act 2022, the ministry has required all of Ontario's health regulatory colleges to develop a new emergency class certificate of registration with the aim of reducing barriers for new applicants in emergency situations. The material for this item was sent to you on Tuesday, August 1st, and was posted publicly on Wednesday, the 2nd. This item is for council's decision. Deputy Registrar Andrea Foti will walk you through the changes that have come from the ministry since we last met. And I'm going to turn it over to you now, please, Andrea.
Okay, thank you, Hanno, and good evening, everyone. you've got in your package a briefing note that walks you through the changes with some analysis, and you have an excerpt of the reg itself. What I'm going to do is I have a slide deck, and I'm just going to ask Amandine to bring that up, please, and thank you. It's wonderful. The goal here is really to try to support and highlight a few things. We know it was last minute notice for the meeting, and you may not have had a full chance to really digest the material. So I'm going to do my best to not repeat everything in the briefing note, but pick out some highlights. And these are the 4 categories that I'll cover. Next slide, please, Amandine. So obviously starting with background, as Hanno said, and some of you may remember from April, the regulation amendment for creating an emergency class really has its foundations in some work the ministry has done. And this is about learning and reflecting on our experience from the COVID-19 pandemic and thinking through pain points that were experienced and how to be better prepared should a similar event happen in the future. And as Hanno just mentioned, the 2 sort of anchor points are the ministry's plan to stay open, and then that resulted in bringing about a statute, the Pandemic and Emergency Preparedness Act. So those are the anchor points for this work. Next slide, please. As Dan mentioned, this culminated in the ministry providing direction to all RHPA colleges, so I think it's 26 total, to create an emergency class of registration. And that requires, to do that, that requires a regulation amendment. So adding a section to existing law that sets out classes of registration, entry requirements and the like. As Dan has mentioned, and we've talked about previously, very tight timelines for this. August 31st, we were notified of the requirement for the regulation, I think just at the end of 2022. And the expectation was that the regulation be developed and all the process steps be completed, of which there are many, and then have cabinet approval by August 31st. And just to pause for a moment, I have been involved in other regulation development projects before, and to give you some context, prior to this experience, a quick timeline on in my experience would have been to complete this work in 2.5 years. Typically, it can take anywhere from 5 to 10 years to get a new regulation put into place. So it just gives you a sense of just how fast both the RCDSO and colleges and the ministry have had to move in this instance. In addition to giving colleges this direction, just as a refresher, the ministry also provided some pretty specific direction as to what should be included in the regulation. I won't read it, but that's highlighted in the orange box on the right side of your screen. The one thing I would pause on that I think has really been a through line is that they have conceived of and have asked colleges to conceive of emergency broadly. This is not just about, COVID-19, although it has anchor points in that. This is about thinking broadly about emergencies that could arise and how we could be responsive to those. So next slide, please, Amandine. Again, just some context and process in case this work is new to you. When a regulation amendment is created, there's work on both the RCDSO side and the ministry's side. And I've outlined some of that in the briefing note. The RCDSO has ownership over process steps largely at the front end of the process. So together with our external legal counsel, Sarah Yun, who's joining us this evening, we developed the regulation language. We did a consultation, which we're obliged to do by law. We brought the consultation feedback and the regulation to council in April for council's approval. And then we've developed a formal submission, again, as we're required to do, to the ministry. And then at that point, the ministry sort of takes over and finishes the process steps. In the latter half of the process, we still have involvement largely to ensure that council's direction is brought to life and is maintained. But the ministry stick handles the latter half of the work. Next slide, please, Dean. I won't go into any detail, but just because it has been a while since April was here, this just captures a few highlights of the regulation. You do have the excerpt of the provisions in your materials at Appendix A, but just to sort of go over in broad brushstrokes, this is a regulation that creates, as we were directed, an emergency class certificate of registration. The class can be opened by either the ministry or council. Applicants are exempted from completing NDEB certification examinations, but they must meet all the other typical requirements for entry for registration. Emergency class registrants must only practice under supervision, and so the supervision is contemplated to be completed by a dentist who has a general specialty or academic license. The license of an emergency class dentist is typically a year in duration unless it's extended, and council would close the class. So in a nutshell, this is really about getting individuals into practice to assist with an emergency situation swiftly. It's not intended to be a long duration license. It's supposed to be responsive to those emergency circumstances. Next slide, please, Amandine. So just a reflection of some timelines that we've managed to hit. In April, that's when council reviewed and approved the regulation amendment. We did a formal submission to the ministry in May. In July, so mid-July and then late last week, we have been engaged in revisions. And then again, August 31st is our target for final approval. Next slide, please. Just a process step, and I think Dan touched on some of these, but as he mentioned, it's very typical for specific language of the draft regulation amendment to change. And we highlighted that for council. It's really about, as we reflect on the regulation and the ministry reviews it, thinking of ways to enhance clarity, to bring council's direction to life, to align with drafting conventions and so on. The pieces to sort of note that I think are important contextually for tonight, RCDSO staff can approve minor revisions and amendments that are really in the category of clarifications and wordsmithing, as long as they're consistent with council's direction. When amendments bring in new ideas, even if we're not concerned about those ideas or we think they make sense, those do have to come back to council for decision. That it's really outside the bounds of staff's authority to start approving new ideas. Council creates regulations, and so that's what's brought us here tonight. So I will go through then the revised regulation amendment, sort of 4 key amendments we're going to talk about. Just to orient you, again, as I said, you have the regulation amendment at Appendix A, page 14. There's been, we're going to focus tonight largely on substantive amendments, which are highlighted in yellow. These are amendments that introduce some new ideas or concepts. I have additionally, though, highlighted and shaded in gray, rather, minor amendments that are clarifications or wordsmithing. We're satisfied at the staff level that the language reflects council's direction, but we thought since we have you, we wanted to give you a full picture of where the regulation amendment is sitting. Okay. Next slide, please, Amandine. So the first amendment we'll touch on, and Amandine, if you could just click further. This is an amendment that the ministry has requested, and it's a substantive amendment. And I'll just sort of take you through it. And the amendment essentially is that we embed in the regulation a waiver or exemption of a specific application fee. So that if an individual in the emergency class post-emergency wishes to apply for another class of license, they don't have to pay a small application fee that would typically apply, okay? And below the yellow box here is a little bit of an explanation for this change. So the ministry has told us and conveyed to us late last week that they require an exemption to be in place to really facilitate movement from the emergency class to another class of license. The reason application fee is highlighted is it's really the only remaining option. All of the other requirements for registration are quite essential. It's language proficiency, it's citizenship, it's a jurisprudence and ethics exam. So the application fee was really sort of one that would satisfy the ministry's direction, but as noted here, has no impact on patient safety. It doesn't impact the requirements for licensure. Additionally, it has minimal financial impact. If you'll just move to the next slide, Amandine, because it's a little bit abstract, I wanted to give you a bit of a case example. So imagine that we have dentist A, council or the ministry's opened the emergency class. We have now registered dentist A as an emergency class dentist. Dentist A has worked during the emergency. Emergency is over, and dentist A wants to go on to apply for a general certificate of registration. So with this amendment we're talking about, dentist A would not have to pay the application fee for the general certificate of registration. We typically, I think it's in the neighborhood of $350, though someone will correct me if that's incorrect. It's just an administrative fee to process an application. But dentist A would have to pay an annual fee required for licensure. So what really we're talking about, this amendment is really operative in the first bullet. It's about, you know, if the emergency class dentist is moving to another class, we aren't going to charge them a small administrative fee to process that second application. Next slide, please, Amandine. Next, we'll just talk about a minor amendment. And Amandine, if you would click for the animation. This was a change proposed by the RCDSO to clarify council's intention. And so this is an amendment to the educational requirements and competencies of applicants to the emergency class. And what it does is it gives the registration committee the ability to review and approve education of emergency class applicants. I have expanded a little bit in terms of rationale in the briefing note, but essentially this step and this amendment would allow the college to be assured that there's alignment with national competencies and also ensure consistency with other classes of registration. So really, this is about ensuring that all applicants, including those in the emergency class, meet baseline professionalism and clinical competencies. Now, why are we talking about that for the emergency class? It's because for this class, applicants will not have had to complete NDEB certification. If they had, the NDEB typically does this review of education at that stage. But because we've waived that, we wanted to make sure that that same function could be fulfilled, and the registration committee is perfectly positioned to do so. They have the expertise to do so. So again, this is a minor change, but it allows the registration committee to be involved in that way, and we're looking into ways we can support the committee in doing so. And here I've just noted one of those possibilities is to create a policy for the committee to assist them. So Amandine, if you'll move on. So the next change is really around opening the class. You heard me say that the emergency class can be opened by the ministry or by council. And interestingly, I'm going to talk to you about two changes, a minor change and a substantive change. These were required by the ministry. The minor change is just some wordsmithing around the ministry's authority, the government's authority to open the class. So they still can open the class. There's just some language changing there about what that looks like. The substantive change relates to council's authority to open the class. And if you'll just move, I think Amandine, there's, yeah. So I'm going to expand in a second on the amendment for council's authority, but I did want to just be clear. These changes, both the minor amendment and the substantive amendment, are going to be consistent across all Ontario Health Regulatory colleges. So every college developing a regulation, as we are, will have exactly the same language. That's the ministry's objective. So Amandine, if you'll move to the next one, thank you. So the amendment here, I want to be clear what it does and what it doesn't do. What the amendment does is it requires council, when council is deciding whether the emergency class should be open, what this amendment does is it requires council to consider factors relating to registration. So council still has the authority to open the class. That doesn't change. The test for opening it is still the public interest. Council still has to determine and only open the class if it's in the public interest to do so. This amendment simply says that in making that decision, council has to consider registration factors, but council can consider other factors as well. So it doesn't limit council to only considering registration factors. They can consider other things, but they must consider registration. So you'll see, and sorry, just before we get to the supervision, I just will say, you can see in the briefing note some analysis around impact, and I'm happy to go back to that. But again, it's substantive because it's not language you saw before, but it doesn't change principally council's abilities here to open the class. Lastly, we have two minor amendments related to supervision, and these were required by the ministry. They're both, as I said, minor. The first one removes the requirement or language that requires emergency class applicants to provide a signed undertaking together with their application. So let me break that down for a moment. The language that you saw in April would have required, if dentist A wanted to apply for the emergency class, there's a number of pieces of application elements that they would have to compile and give to the college. What we had originally in April was a specific requirement that they had to have secured a supervisor and had that supervisor sign an undertaking, which is a legal document setting out terms and what the supervision will look like. That all had to be done before they could apply. What the ministry has done here is they've said they think that that's a barrier. We can certainly have an undertaking and require that. The ministry just doesn't want us to require it to be done at the front end like that before someone can apply. So what they've done is they've removed the requirement for an undertaking to be provided at the time of application. They've reworded the requirement to just make it clear, absolutely supervision is required. Emergency class applicants and registrants cannot practice without supervision. So really it's an operational change as to what information must be provided at what point. So core requirement for supervision remains in place. The college most certainly could require emergency class registrants to sign and supervisors to sign an undertaking. It just means it doesn't have to be done at the time of the application. And operationally, we're going to explore tools to just clarify all of this for applicants. There's a lot of detail here. I'm not going to go into any level of detail about those supporting elements tonight because we're just focused on the regulation, the legal language, but I did want to just highlight we are going to try to make it as easy as possible for applicants to understand what they need to submit at what point and so on. So next slide, please. I wanted to just highlight a couple of things related to process. So there's really two streams of work, and Harinder touched on this in his remarks. So obviously tonight our focus is on finalizing the regulation, and that's going to be our focus over the coming days. The ministry largely leads this work, although obviously, as we're seeing tonight, the college has a key role in that. And then there is work underway to implement the regulation, and my briefing note and Harinder's comments acknowledge the support we've been getting from our working group. That will continue. And you have a bit of detail in the briefing note on that, and I'll talk a little bit about implementation in a minute. Next slide, please. So just to expand briefly on both pieces, finalizing the regulation, of course, our target, our sites are set on August 31st. So based on the decisions we're going to ask you to make tonight, we will action those. Should you approve the regulation as it's revised, both Harinder and Dan will sign and seal the regulation, which is an important formal step in our process. At that point, the RCDSO's obligations end. The ministry then takes that signed and sealed regulation and they prepare a submission for cabinet, and it's cabinet that does the final approval. Okay. Next slide, please. I wanted to touch briefly as a process element on an exemption request, and I highlighted this in the briefing note for you. It's the second decision we're going to ask you to make tonight. It's a little bit unusual, so I wanted to talk you through it so that you understood why we were asking you for it. Typically, when we have a substantive change to a regulation, we do have a requirement to recirculate that, so send it out for consultation again. We do not have time to do that with the ministry's timelines. So next slide, please, Amandine. So the ministry essentially needs the signed regulation from us as soon as possible. Really, we're targeting Tuesday, subject to your decision tonight. So because we have a legal requirement to recirculate, yet the ministry's own timelines won't allow us to do so, we want to make a formal request to the minister to exempt us from recirculation. That's just to make sure that there's clarity that we are doing our utmost and following the proper processes legally. So Sarah Yona has helped us in preparing a letter. And again, pending your approval, we will send that off. It will be part of our next steps in terms of finalizing things. In terms of timing, you can see here, everything is going to be moving quite quickly depending on your decisions tonight. So we are really targeting Tuesday to finish our pieces at the RCDSO, and then quite quickly after getting the signed and sealed regulation, the ministry will move ahead and prepare its cabinet submission, and I think they'll do that as quickly as they can next week. Just briefly to touch on implementation, there's a number of things the working group has been supporting us in doing. Some of these are documents to support college decision making that is enabled by the regulation. Some of it is about information that we can develop to support applicants and supervisors. There are going to be bylaw amendments that we have to bring forward to allow us to embed some changes related to fees. So that's all underway. We have been active with the working group over the summer, and I just want to briefly acknowledge my thanks on behalf of staff for their flexibility in giving us their time this summer. We will be bringing some bylaw amendments to council in September with a view to finalizing those at December council. And we are targeting to finish the rest of the implementation work by fall, this fall 2023. So all moving quite quickly. So that brings me to the last piece, which is just to highlight your decisions. I will just touch on them briefly in plain language, but Hannah will take you through the motions. So the first and foremost, we are asking you whether you approve the substantive changes that have been embedded in the regulation. And again, those are the elements highlighted in yellow in your Appendix A. The second decision, just next slide, please, Amandine. The second decision is whether you direct the registrar to send that exemption request related to recirculation to the minister. And as I said, this is an essential step in order for us to complete our work and sign and seal the regulation. So with that, that's the end of my remarks. I, of course, have not done this work alone. There are a lot of people working on this. I'm joined today by Sarah Yun, who has been providing us excellent legal advice throughout. Sarah can help with any questions you have, as can Dan. So Hanno, I will turn it to you to help us moderate any questions, and then, of course, the motions in due course.
Thank you very much for that, Andrea. So Council, what I'm proposing, and you will be considering both motions, but right now we're going to focus specifically on the first motion. And in order to move discussion effectively and efficiently, I'm going to propose that the first set of questions be questions asked of Andrea, questions of clarification. So if there's something that you didn't understand, if there's something that requires a more fulsome explanation, those are going to be the first set of questions that we will address on the speakers list. Once we have exhausted that speakers list, then I will ask that the motion be posted. I will ask for a mover and a seconder, and then we will have discussion about the merits of the motion. So I think this would be the most effective way of dealing with the time that we have together. So again, if you're putting your hand up now, it's because you're asking Andrea to either further explain something or to repeat something that you misunderstood or didn't hear. So these are questions of clarification first. So I do have a few people on my list. And so Harinder, you're the first one on my list.
Thank you, Hanno. I don't have any questions. I just want to thank Andrea and her team for their hard work over the last week or so. We have been in touch. I just want to emphasize to the council members that all of these changes which we are approving today or will approve today do not change the crux of the regulation. They are pretty much really sort of, to me, administrative changes, the fee exemption and some of the other issues. It does not change anything. So I personally feel that council will take all that into consideration and approve it. Thank you.
Thank you, Harinder. Next on my list is Jamie.
Yeah, thank you, Andrea. My question is maybe a little bit technical, but the ministry responded to the regulations that we discussed and approved at council in April. And I noted in one of your bullets where you said the ministry will be putting together the regulation. Is there a chance that the ministry decides on an amendment of our amended regulation? In other words, will they put their hand up and try and change something once again before this whole process? Or will they be accepting exactly as you submitted the regulation?
Thanks, Jamie. I'll start, but then I'm going to ask Sarah just to come in as well. Jamie, to the best of my knowledge, no, I think the ministry is looking for council's decision and would not make changes without us. They recognize council makes the regulation. That's the legal authority. So as much as there is some back and forth and the ministry has required some changes, the ministry recognizes very well that council needs to be the one to sign off on this regulation. So no, I would not, that to me is not a risk that they're going to somehow post your decision tonight, go and change it unilaterally. But Sarah, I don't know if you have any comments or questions or to add there.
Sure, I agree with Andrea's comments. And I would add that at this stage, the ministry is really looking to council for approval of that signed and sealed reg. After that is done, it is put into a package for committee and then cabinet. So there is discussion at those two levels. And of course, we don't know exactly what will happen at that time, but it is likely that most of the substantive changes have been completed at this point, and that's why the negotiations between the ministry and the RCDSO have been happening in the last couple weeks and really in the last couple days as well.
Thank you, Andrea and Sarah. Ram, I know that your hand was up, but it's not up now. So has your question been answered, or do you have a question?
Perhaps. I think I was going to ask about that these new registrants will have to have supervision by a dentist. Are there any details of that? What kind of supervision, what sort of relationship that would have?
Andrea?
Yeah, thank you, Ram. This is a key issue that our working group has been discussing. So we've met now, I think, on at least two full meetings. We have focused on supervision. Our approach will be to develop a sort of a guide about the different requirements of supervision, what it would look like, what qualifications does the supervisor need to have. So I don't want to detract from the conversation tonight to really expand on that, but Ram, I would just say there's a lot of work and energy that's going into it, and it is our intention to provide that detail so that when the time comes that this class is open and we need supervisors, that there is that detail ready. But I do see Sarah's hand, so I don't know if she wants to add something.
Sarah?
Thank you for the question. So at this level, at the regulation level, all that is required for council approval is whether supervision will be required of the emergency class registrants. And all the details as to how that will work, what level of supervision is required, who can be supervisors, all of that gets worked out in policy and through the administrative process. So at council level today, the question is really, in this regulation, you have required supervision that is approved by the registrar. So presumably there'll be room there to make it appropriate for each individual. And all those details, the way that it's crafted, the regulation language is crafted is such that a lot of the administrative details can be worked out in practice, and there's more flexibility there than going through a 5 to 10 year process to change a regulation, as Andrea mentioned. So what council's making a decision on today is really that amendment of removing the undertaking and just ensuring that the supervisor is approved by the registrar. So those two are the key changes from that bundle of amendments.
Thank you.
Thank you, Sarah. So at this point in time, I have no more speakers on my list around clarification. So what I would ask is that motion number 1, please be posted on the screen. I will then read it into the minutes. I will ask for a mover and a seconder, and then we will entertain discussion that is specifically geared to this motion. So for your consideration, council, is motion number 1, that council approve amendments to Ontario Regulation 205/94 as amended to date, made under the Dentistry Act 1991, as proposed by the Minister of Health and shown in Appendix A, to create a new emergency class certificate of registration. And I see Ram. Are you moving that motion, Ram?
Yes.
That's moved by Ram and seconded by Ellie. So at this point in time, if there are questions or comments geared to the language in this motion, this is what we would be entertaining now. We have set aside time for discussion. So if you have a comment, if you have a question, if you have a concern, we encourage you to ask and make those comments now. I will be keeping a speakers list. I will give first-time speakers preference, and I would ask, because we're hopefully going to hear from a number of people, that you keep your comments to under 2 minutes so that we can get as fulsome a discussion as possible. So the first person that, David Bishop, did you have your hand up, or did you not have a question? David, you're muted.
There we go. From a public member point of view, how are we going to monitor this emergency class of practicing dental. So,
And Andrea, I'm going to automatically turn to you unless you tell me to redirect to someone else.
Yeah, that's fine, Hanno. Thank you. So David, I'm not entirely sure I understand what you mean by monitor, but I'll take a stab and then you can tell me if I've answered your question.
okay.
So an important check and balance that we've put into place to make sure that the emergency class is practicing safely, providing high quality dental care is supervision. So emergency class dentists can only work under the supervision of another dentist who has a license with us in the general class, specialty class, or academic class. So there's no intention to specifically monitor individual dentists unless, you know, if there's a complaint or some other event that happens, the regular college processes would apply. These are registrants, just like any other class of license, but the special requirement that applies here is a requirement for supervision. So that supervisor will have duties to oversee the practice of the emergency class registrant and provide reports to the college. So you'll have to tell me, did that answer your question or can I help with something else?
Well, have we any idea what the size of this class group will be?
No, unfortunately, that's anybody's guess. It's really difficult to know what we might be dealing with. So, but I see Dan's hand. I don't know if Dan wants to add anything there.
Dan?
Only to add, David, that it's conceivable that this regulation for RCDSO or any other college may never be invoked, because it does have the prescribed criteria that Andrea mentioned earlier, that the ministry has outlined in every single one of the 26 regulations. So it may never be invoked by any college, or it may be by a very small number of colleges. And if it were to be invoked by RCDSO, I don't know if we could anticipate at this point what would be the emergency that we're trying to solve, how many people would respond to that or be available to respond to that. But I would suspect that if we got into that position where it was invoked here and we did have applicants and we did have individuals who were, they had that class and were practicing under that class of certificate, we would want to do an evaluation once it was closed as well. So we'd have the supervision aspect for individual practice. And as a college, I think it would be good practice for us to evaluate how that experience went. So I don't think we have a ton of answers to your questions, but hopefully those outline some of the broad criteria that we would be looking at.
Thanks, Dan. Next on my list is Nalan.
Yeah, thank you, Hanno. This is just to maybe build on David and Dan's comment. We're being asked to approve this regulation, but not just us, all the colleges, all 26 are being asked to approve this regulation. But I don't know if all will have to react equally. For instance, there should be some consideration, and this is directed to our registration committee and our working group, not to the ministry. There should be some consideration to the type of emergency we're dealing with. Like an outbreak of a virus will require certain, responsibilities from the dental profession, but that's, say, different than an outbreak of dental caries, which will require more. So even though we're all approving this, we're all different. And two, there should be some consideration to human resource requirements. And unfortunately, we don't have data on this, but right now, do we have enough dentists to deal with the population, to deal with what we deal with right now? Do we know, are we overstaffed, understaffed? And then if a emergency situation arrives, do we need more, but not more? How much more? Do we need X amount of dentists? Because if the registration committee is tasked with approving X amount of dentists and they approve 3X, then there's no service being done to anyone. So going forward, I think it's important we as the college do keep some stats on human resource requirements. Thank you.
Thank you, Nalan.
Hanno, if I could just respond,
Please.
Really great points, Nellen, and thank you. I did want to just provide some reassurance that part of the working group's discussions to date have really talked about when knowing that council can open the class, what should guide council's decision, and some of the concepts we've talked about align with what I'm hearing you say, which is, what is the emergency that's at play? What role could dentistry play? What about health human resources? Does our current complement of dentists allow us to respond to this, or do we need more? So I just wanted to kind of offer that. It's still a work in progress, and our intention is to develop some kind of infographic to support council decision making. But I did want to just let you and the rest of council know that those are some of the discussions the working group has had, and some of those concepts have come through. So
Thank you, Andrea. And Sarah, I'm going to jump to you first because I think you may want to add to what Andrea just said.
Yes, thank you. And following on both comments, I would like to assure council that the current language around opening the class accounts for all of these possibilities. So the language is intentionally vague, yet specific enough. So we're using terms like, quote, emergency circumstances, which can be interpreted as an emergency arises, and as well, the class only opens in the public interest. So again, broad, but still within the scope and of course the mandate of this college. And as rightly pointed out, that mandate looks different for every single college, but all colleges will be acting in the public interest when considering whether to open the class. So that flexibility is built into the regulation, the draft of the regulation you are looking at approving today.
Thank you for that, Sarah. Rod.
I think it's my question's direct. Andrea, I guess I'll direct it to you and Sarah as well. As a public member and having not gone through a regulation change, just maybe this is more background, but if we'd had the luxury of time, you said this thing normally takes 5 to 10 years. What steps might we have done? And if we're not going to do those, what gaps are there to our normal process? What risks are being assumed and how we are mitigating those? I guess so that's the net of it. I don't want you to boil the ocean here, but I want to get a feel for what we're leaving out by not taking a longer process.
Sure. So I'll start. I think, Rod, we're following all the required steps. So I want to just be clear, although this is we're moving quickly, the steps that are required to bring in a regulation, we have followed. So those are developing a regulation, doing a 60-day consultation, bringing that to council. The only exception I would offer is just your second decision point tonight. If we didn't have an August 31st cabinet approval, typically we would recirculate the changes in yellow, the substantive changes. We would typically recirculate those again for a consultation. So that's the only step we can't do because of the ministry's timing. But all of the other broad steps we have taken, I think the only thing I would say is that, generally, given the luxury of time, you would just have more time to reflect on the content and think about it and think about implications and build out your implementation infrastructure. So we're having to sort of do the implementation simultaneously to the reg being finalized. So it's all condensed, but there are no major process steps we are missing aside from the one we're seeking an exemption from, which is the recirculation.
Just a corollary, is that recirculation to the general membership?
It's to a range of stakeholders, Rod. So it would be to the profession of dentistry, it would be to the public, and it would be to a range of stakeholders. So I don't have the list in front of me about all of the stakeholders we went out to earlier this year with the draft regulation, but we would have if we had been able to do the recirculation, we would send that out to all of those same individuals. So it's public and profession.
Thank you.
And
Dan?
Yeah, I think the point's been made, but I just want to be really clear. This regulation has been circulated. It was circulated after executive looked at this, the first draft in January, and then there was a 60-day period where it went out to all of the stakeholders, and then council saw it in April. So I don't want any council member to think that we have not circulated it at all. We have. But for this version, with all the reasons that Andrea has described, including the ministry's timelines, it would not be recirculated under these circumstances. But to your question, Rod, under other circumstances with more time, we probably would. And I also want to say to council that we have spent a lot of time on this. We have been very careful in terms of the language to ensure that whatever results from the regulation and the class of certificate, that the public will be protected. So we have done that due diligence. I think when you look at regulations, you can anticipate that you're going to live with the regulation for 10 or 20 years because they don't change very often. So having a bit more time to really think about what this is going to mean and how language will be interpreted, sometimes you just never know until it's live and you're dealing with real life cases and you're collecting data on what's working and what's not.
Thank you, Dan.
Thank you. Thank you, Andrew. Thank you, Dan.
Sarah?
I would echo the comments that essentially the timelines would just be way more relaxed. This wouldn't be a special council meeting in the evening in the summer. The working group probably wouldn't be meeting as diligently in the summer. All these things are just so compressed. So really, I think, you know, as Dan has mentioned, staff has moved mountains to not only do their regular work, but also move this along on the ministry's timelines. And it's been a lot for the ministry as well to push through this. So we're all in this together to meet that August 31st deadline. I would add one clarification. Andrea mentioned the $350 fees exemption. So I confirm that is the case. And also it is only applying to the emergency class registrants who are applying to general, specialty, and academic class. So it's a limited fees exemption in that sense, and it's only the application fee, which is a one-time fee when someone wishes to register.
Thank you, Sarah. And next on my list is Jamie.
Yeah, thank you for all your answers, Sarah. What kind of disturbs me a little bit is your comment about the vagueness of the emergency class. And I understand it purposely it is something that governments like to do, but wouldn't it have been better to have had a core list of emergencies and then work around those from a tertiary point of view? To me, you know, an emergency could be, and correct me if I'm wrong, any staff, let's say Peter Deline in his territory needs dentists for access to care, et cetera, et cetera. Is access to care a potential emergency? And is, you know, following up on Nalan's point, would we need to attract put together an emergency for personnel to travel to the north, for example, the far north, to provide access to care?
And Jamie, are you asking this of Sarah or of Andrea, or would you like to hear from both?
I'd like to hear from anybody that has a particular reaction, maybe similar to mine. And, you know, a definition of emergency needs to be there in my estimation. And I just, you know, I'm quite disappointed that there's not a little more specificity regarding that.
Okay. Andrea or Sarah, I'm going to throw it over to one of you.
Sure, I'll start, and Sarah will come in. Thanks, Jamie. I understand. I think that definitions give us certainty and allow us to have some margins around what we're talking about. So I understand entirely what you're getting at. I think that here, the flip of having a definition, so just to maybe give you an alternate view of this, if we were to have something like a list, invariably when you have a list, you can leave something out, and then you have something really specified in regulation that could prevent us from acting when we needed to. So although I understand the interest in having more specificity, what I would say is the regulation is one part of this, okay? The regulations by design, they're legal instruments and documents. By design, they are meant to be high level so that they can be responsive to a variety of circumstances. If I take you back to the origins of this work, which is emergency preparedness, wanting to be able to have entities like the college be able to respond to whatever's coming. None of us could have, well, at least me certainly, as a non-clinician, did not foresee a COVID-19 pandemic, and yet it was upon us. So I would say that the flexibility in a legal instrument is not unusual. It's not unusual to have powers and authorities framed broadly in that type of a document, but the regulation doesn't live on its own. You heard me say a moment ago, our working group has been thinking about how to put some shape to council's authority. So if council's one of the decision makers, which we know they are in opening the class, how can we add a little bit to that, put some meat on the bone so that council is clear and certain when it should make that decision, what factors should it look at. So we are going to be developing a document to assist council that will have more specificity. Now, we've not talked about a list like you've described, but we have talked about, as I mentioned to Nalan's statement and in response, we've talked about some factors, some things to think about, some criteria. So I'll stop there and maybe just offer Sarah to come in if she wants to add anything.
Thank you, Jamie, for those comments. So I'll just start off with the last comment you made first and work backward. So with respect to, quote, sending dentists to serve in remote areas, I think at a previous council meeting I had attended, Alan had advised that just would not be possible within the RCDSO's framework to make certain registrants work in certain places. But beyond that, with respect to the definition of emergency, I will say when we first started drafting this and started brainstorming in January, it was something we considered. I'm sure it was something the ministry considered as well. But given the nature of an emergency and the fact that we have all gone through an experience that is something that most of the world could not have predicted, really is the impetus for this type of class. So we're really looking at something that is unforeseeable and that would require sort of a quick registration process. So there are still constraints. I didn't mean to suggest there weren't constraints around opening the class. Like absolutely there are. It may not be right in the emergency class section, but in general, in the role of the college and what it can do, there was constraints laid out there. But as Andrea mentioned as well, my final comment is that council can adopt a policy to provide some guidance around that. So very much in the same way that the supervision requirement is not going to be laid out, and regs do not do that. Regulations customarily do not lay out step by step all the application pieces, and that's why there's application guides that are prepared by staff to explain to an applicant exactly what is needed. But what the regulation does is provide that legal framework of what absolutely needs to be in place. And colleges, it's open to council to approve a policy to guide council in the future, if that is a concern. And I know that is actually on the agenda of a number of other colleges. So that is part of the whole implementation process. It's another piece. So I'm glad actually that you raised that.
Thank you. Rod, I still see that your hand is up. Is that a question or you just have? Okay, thank you. So I would ask if staff could please put the motion back on the screen so that council can see the wording in the motion. So council, this is the motion we're considering. It's been moved and it's been seconded. This vote requires a simple majority. And what I would ask now is that all those in favor of this motion, if you could please raise your virtual hand, and Angie and I will do a count. And I would ask that the motion now be removed from the screen so that Angie and I can do a count. I have 19 in favor. Do you as well, Angie?
Yes, 19.
Okay, so if you could lower your hands now, please. Lower your hands, please. Thank you. Are those opposed? Abstaining? Okay, one opposition. So 19 in favor, one opposition. That motion is passed. Thank you very much. I would ask if staff could please post motion number 2. Motion number 2, please. And this for your consideration, council, is that council direct that the registrar request the Minister of Health to exempt the proposed regulation amendments from circulation. And I'm looking for a mover and a seconder for that. Moved by Brian Smith, seconded by David Bishop. And I will now start a speakers list. Okay, I've got a few names on here for the speakers list. I'm going to start with you, Brian Smith. Brian, did you have a question?
Sorry about that.
Not a problem.
I'd just like to take a moment to express, as a public member, my thanks and congratulations to all the staff and the support staff that were involved in this, and the working group. We've, I think, come up with a very good substantive entity that will serve us well going forward in the emergency cases. And again, I just wanted to make sure that staff receive the recognition that they should on a great piece of work here. And we'll look forward to the ministry's approval of it. Thank you.
Thank you very much for those comments, Brian. Next on my list is Anthony Lisho.
Hello, thank you very much. I would just like to point out that I had lost my internet connection, and I just wanted to make sure that I got back in time to vote. I did vote, and just make sure that that was counted. Thank you.
It was because the number of votes in favor and the one opposed equaled the number of people in attendance. So your vote, you made it back just in time and your vote did count. Thank you so much. Daniel.
Thank you. I certainly understand the need for this second motion, and I know also I'm being pedantic, but I think potentially it could be setting a problematic precedent unless it was reworded somewhat. And I'm just wondering if it should be reworded something to the effect of, in order to enable finalizing the regulation in a timely manner, the RCDSO is seeking exemption, et cetera. And the reason why I think it should be qualified is that right now it doesn't state why we're seeking exemption. And someone could infer that, oh, sometimes the RCDSO follows process, sometimes they don't, because the process is to send it out for circulation. And we're not doing it this time because we can't. The timeline is just far too short. So I think if we somehow qualified it that we're doing this in order to achieve the objective in a timely manner, then this is why we're seeking exemption. Otherwise, years from now, looking back, it says, well, you know, sometimes they followed the motion or this process, sometimes they didn't, and I'm just troubled by that.
Thank you, Daniel. So Andrea, do you want me to start with you or should I go to Dan first?
Well, I actually would invite Sarah. I don't know if Dan has comments, but I just want to make sure that Sarah's comfortable. She drafted the motions and knows this exemption element well. So I'd like to make sure she has a chance to comment.
Thank you, Sarah.
Thank you, Hanno. So just by way of background, in terms of how exemptions work in the circumstances. So the RHPA sets out the requirement for the 60-day circulation to members and the public. And that right after that requirement appears in the RHPA, there's another section that gives the Minister of Health the ability to abridge or to exempt the circulation. So this is embedded in the RHPA. It's contemplated that it will be used. And there are two checks, at least in this process. One is obviously council is considering the motion. And secondly, that the Minister of Health will grant that exemption. So we still don't know what the Ministry of Health would do in that circumstance. However, given that the Minister of Health is the one that is leading this regulation and is also constrained by the August 31st, 2023 deadline, I think that would likely be part of her consideration. Of course, I don't speak for her at all. So I am happy to add that wording to say to exempt the circulation period in order to meet the August 31st, 2023 deadline in OREG 508/22 or whatever the numbers are, that we could put that in, that this is specifically because we are constrained by a timeline that is actually set out in a reg right now.
That'd be great. Thank you.
Thank you, Sarah. And Andrea or Dan, do you want to add to that?
Hanno, the only thing that I would add is, as Sarah said, this is completely at the minister's discretion, and the minister will make a decision. We have had conversations with the ministry staff to flag this as a possibility, so it's not going to come out of the blue. But again, it is completely the minister's decision to make.
Okay, thank you for that. So then for me to clarify, the motion that we will be voting on shortly, are we going to include sort of the friendly amendment that has been proposed, or are we going to stick with the language that was posted on the screen originally? And maybe Sarah, should I ask you that question?
Yeah, I think what would be appropriate for the process, I have suggested some additional language. If it's appropriate, we could take a vote just on whether we like that amendment now, and if we don't, then we could go back.
Okay, so I still have my speakers list, so I am going to ask you if you put your hand up to speak, if you would put it down now, and I'm going to follow Sarah's suggestion. So this is basically sort of a friendly vote to see if the language that Sarah proposed that addresses Daniel's concern about sort of clarity or specificity around why we're doing it at this time. If council as a whole is amenable to that, if you would please raise your virtual hand now. Okay, well, that then carries. So if you would lower your hand now, please, and then when we vote on this motion, it will be including that sort of that caveat that was suggested by Daniel and that Sarah expressed. But I still have two speakers on my list before we reach that point. So Aaron, you had your hand up. Has your question been answered?
No, I just wanted to, well, I don't think that the changes, although they're considered substantive, I don't think they're inconsistent with what's come out in previous consultations. So I do support waiving or getting the exemption. But just for thoroughness of discussion, was it ever discussed the options of either asking for the exemption or asking for an extension on the deadline so that the consultation could be done? And if you could just maybe explain a little bit about what the benefits are of going this route versus the other way, obviously, aside from being efficient.
Thank you. So Andrea, I'm going to throw that over to you.
Sure, and I'll quickly engage Sarah as well. But Aaron, just to underscore for you and for all of council that the August 31st deadline was set by the ministry, and to my knowledge, though Sarah will correct me if I'm wrong, it's actually set in law. So there was absolutely no flexibility on the August 31st deadline. If there was, believe me, we would have asked for it. The August 31st has always been the end target point, and really August 31st, it's not really August 31st because that's when cabinet has to approve it, and cabinet needs time and committee needs time to review it. So the best information we had is that no movement there, and our ability to be responsive and to consider whether we could recirculate is really predicated on when the ministry got those amendments to us, and they got those amendments to us that we're presenting last week, end of day last Wednesday. So we needed to talk to them about it and review them, and we did that on Friday. So there was just really, if you have your calendars out, really no time at all for us to even contemplate doing a recirculation. It just was not possible. Originally, the ministry wanted the regulation signed and sealed this past Monday. So Sarah, I would just look to you though, in case there's anything you would add on those points.
Yeah, as Andrea mentioned, we actually did get an extension to have this special council meeting and to follow our notice procedures. So we did say that we could not get it in for the date they hoped for, which was on Monday, because we wanted to bring this back to council, and because these amendments, again, not going to necessarily the core, but still are different than what you had approved in April, that was important to get council's approval on. With respect to the application fee, just in general, and the exemption, at the end of the day, there was actually not a lot of other exemptions to choose from. We had already required the emergency class to have language proficiency, citizenship, jurisprudence, a dental program. So the last piece was the registration examination, which is critical for baseline competencies. So this was the last piece that we could think of, which was the application fee to move things along. So that's something just to consider as well, that there weren't necessarily a number of options to choose from at this point in time. There were very, very few options, and this is where we landed in discussions with the ministry as well.
Thank you. Anthony, you're next on my list.
I just had a quick question. I agree with the amendment that Daniel proposed, but I'm just wondering, do we have any requirement that we have to go back now to the minister to get their approval? I guess this question is for Sarah.
So council is deciding on whether to direct the registrar to write that letter and send that letter to the minister. So if council says yes to this motion, the letter will be sent to the Minister of Health to request this exemption, and the Minister of Health will get back to us and say yes or no. So we haven't reached out to her yet because we had to get council approval first. But if council says yes, then we will send that letter requesting for an exemption. And in that letter, we'll also explain the rationale that this is in order to meet the timelines set out in legislation.
Just to follow up, Hanno, if the minister decides not to accept this change, will that mean a further delay on their part? Does that mean we have to meet again to vote again?
Sarah?
If the Minister of Health rejects the request for an exemption, then the RCDSO would circulate. So you would not meet again. That would be staff's work. We already have your approval because of that first motion on the regulation, and the circulation process would then begin.
Thank you. So there are no more speakers on my list. So again, council, just to remind you, the motion that we're voting on is that council direct the registrar requests the Minister of Health to exempt the proposed regulation amendments from circulation, and then adding on sort of the clarifying language that that Sarah proposed. Before we do that, unfortunately, because I've got lots of names on my list, Angie, I just want to confirm with you that when we posted the motion the first time, that I did get a mover and a seconder for this motion.
Yes. Yeah.
I did. Thank you so much.
Mhm.
So all of a sudden I couldn't remember if I had. But now that that motion has been duly moved and seconded, okay, before we vote, Dan?
I just want to make sure that Angie has the extending language that Sarah said earlier, because that'll be important to capture when you vote on the motion and for the minutes, obviously, and for the letter to the ministry.
Okay, thank you. So Angie, can you confirm that you do have that?
No, I don't. I want to speak to Sarah about that language.
Okay, so
I will.
Sarah, can I put you on the spot now, or is so that you can draft that now so that we can all hear it when we do vote?
That's perfect. I'll actually put it in the chat. So the last portion will say, in order to meet the August 31st, 2023 deadline set out in OREG 50822. So I'll put that in the chat. That clause will just be put at the end of the current motion.
So then, council, the motion that we are going to be voting on is that council direct that the registrar requests the Minister of Health to exempt the proposed regulation amendments from circulation in order to meet the August 31st, 2023 deadline set out in OREG 508/22. So then, Dan, that deals with your concern, correct?
Yes, thank you.
Perfect. Okay, so again, what I would ask all council, all those in favor of this motion, please raise your virtual hand and keep it up until Angie and I do a count. And you hear me ask you to lower it. So Angie, I have everyone voting in favor.
Yes, I have 20.
Okay, thank you. So that motion is carried. Thank you very much, council. You may now lower your virtual hand. Again, I would like to thank you for your guidance that you've shown in this matter and for your ability to meet on such short notice. I would also like to take this opportunity on behalf not only of myself, but on behalf of council to once again thank staff for the incredible amount of work that they have put behind this, not only in the work that they've done behind the scenes, but in the work that they've done to bring this meeting together and to organize the materials that were shared in such a comprehensive and educative way. So thank you very much for that. As we come to the end of our agenda, I would just like to remind you that our next council meeting will be a hybrid meeting held on Thursday, September 21st, 2023. For those attending in person, we will again be using Vantage venues at 150 King Street West in Toronto. However, the September meeting will be live streamed as usual. So we are now at the end of the items we need to deal with for this meeting. I would ask for a mover to adjourn the meeting, moved by Anthony, seconded by Daniel. All those in favor, you can raise your hand physically or virtually or whatever you would like to do. Thank you all for that. The meeting is adjourned, and enjoy the rest of your summer, and thank you all for your participation today.
Thank you, Hanno.
Thank you, everyone.
Thank you, everyone.
Thank you very
Good night.
much.
Good night, everybody.
Good
Thank
night,
you.
everyone.
Bye.
Good night. Have a good summer.
You too.
Yeah, you too. Thank you.
Bye, Vivian. Bye, Ellie.